on Health, your weekly dose of health and wealth information on KuTV.
Kidney Awareness Day is celebrated every year on the 11th of March. What are you going to do this year, and how will you celebrate and create awareness on kidney failure and show love and support to all those people suffering from various kidney diseases? Of course, you can talk to us and also join a conversation on our social media platforms at KuTV Focus on Health on Facebook and also on YouTube, and Health Focus on Instagram. But even before we see Daktari on that conversation, here now is the health update. Very informative. With me on set is Daktari, who is taking us through kidney transplant and kidney failure. Of course, you can join our conversation on our social media platforms at KuTV Focus on Health on Facebook and also on YouTube, and Health Focus on Instagram. Hit us up with all your comments, suggestions and queries, and even tell us what you think is the importance of kidneys, and do you know anything about kidney failure. But even before we head on to that, Daktari, thank you so much for joining us today, and kindly introduce yourself to our viewers.
Thank you very much, Michelle, for inviting me to this meeting where we'll be discussing kidney diseases and their treatments. And I hope our general public will benefit a lot. My name is Moturi George. I'm a kidney doctor. I treat kidney diseases, but I'm a general practitioner, physician. I work here in KU as a lecturer at the Department of Medicine. And I'll be happy, Michelle, to listen to what are your worries in kidney disease and how they are treated, and probably you will learn a lot along the way.
So, Daktari, we know that the kidney plays a very important function in our body, but what exactly is the organ kidney and what is its function?
Michelle, that's a crucial question, and we need to understand generally that our bodies are made of cells, and when cells come together make organs, and organs make organ systems, and the systems make the body. Without all these systems, then we cannot be able to function. Mm-hmm. All systems work together so that we are who we are. Now, one of the systems is the system that takes care of removing waste products and producing or removing excessive water that one takes in. Mm-hmm. As you take in food to ensure that you continue doing your activities, that food is broken down into pieces. When doing that process, you produce waste products, including water. This has to be removed so that you continue maybe taking another meal next time. Otherwise, you eat once and that's it. And I can imagine God made you in a way that you continue eating so that you continue working. Mm-hmm. The kidneys or the urinary system is the one responsible for removing those waste products, removing the excessive water. The kidneys are two, just below the diaphragm, below the lungs, or below the heart, next to the stomach, on either side. On the right side is quite close to the liver. Now where the liver is the big organ that also does a lot of detox when people talk about detoxification. And on the left side is the pancreas, just to the left of the stomach, at the back. So that's where when people have problems, the kidneys, they usually point to the back on either side. So that's where these two bean-shaped kidneys are located, probably about 20 grams on either side. The one on the left is slightly higher than the one on the right because of the effects of the liver during development. So they remove these waste products, including water, the products of metabolism that are harmful to your body. There are many, and many of them I'm sure we'll be mentioning a few along. The end product is urine. That's what everyone sees. That urine has got a lot of products in it that are meant to be purified from the blood. So the blood comes into the organs filter them out, water and those waste products, and eventually you pass urine. You take too much water, you tend to pass more because water is also toxic. So you need to remove excessive water. You take too little, you conserve, so that you don't get dehydrated. So that's where the amount of urine one produces per day keeps on varying, but generally about a liter, 1 liter to 2 liters, generally speaking.
Okay. Dr. What are some of the kidney diseases that we have and what actually causes them?
There are many diseases that affect the urinary system or the kidney system. So they can be within the kidney itself, or they can be from other organs that affect the kidney, what we call organ crosstalk. Or they can be obstruction, that urine or water that you produce in your kidney does not flow down to come out. So if you block that, then the effect of backward pressure then causes injury to the kidneys. So generally speaking, in our setup, the diseases can be from infections to non-infectious diseases to genetics, I mean, what makes one body, to toxins that you may be exposed. So if you talk, the commonest causes of kidney disease in our setup will be, other than the hypertension and diabetes, it will be infections. Malaria causes kidney disease, and other viral infections are quite common in our setup. And other diseases are actually intrinsic kidney diseases. We call those ones inflammation of the kidney, what we call glomerulonephritis. So those would be the commonest causes of kidney disease. Heritable diseases are quite common as well. There's kidney diseases where the kidney swells up with cysts inside, and that is what we call polycystic kidney disease. That's an heritable illness that is passed on from one generation to the next. And just those to mention a few that will cause problem with the kidney. But what one needs to remember, the most important ones are the infections, the diabetes, and the hypertension, because those you can do something about.
Do we have perhaps risk factors that actually make you prone to contracting these kidney diseases?
Those are when you discuss risk factors, is whatever in the environment or within yourself that predisposes you to having impairment of a certain organ or organs. So primary diseases that cause kidney disease have risk factors. Your genetic makeup can be a risk factor. Okay, so if you eat certain foods, you end up exposing yourself, depending on your genetic makeup, into a particular illness in the kidney. So the commonest risk factor, therefore, for kidney diseases will be, for example, hypertension. If you have high blood pressure itself, well controlled, does not cause kidney disease. Some people believe so. But if you don't control it, then that's a high risk factor for having kidney disease. The other one, the commonest one, is diabetes. The other risk factor is the genetics that we have talked about, and more important is infections. If you are predisposed to having infections or having chronic infection, then there's a possibility that you may end up having kidney disease. Kidney disease or kidney impairment. When you have kidney disease, you can have a disease without impairment of function. Most people do not know that because the disease is silent. But you can have impairment of function. Once it reduces significantly, that's when you start having symptoms.
Dr. What exactly causes kidney failure? Because in as much as it plays an important role, we've come to understand that it can actually fail.
Kidney failure, kidney disease, kidney problems, these are interchangeable terms depending. Failure means is a function not working well. If it's not working extremely well, then you end up not sustaining your metabolic needs to continue living. So the kidney is essential for survival. But if the function is reduced slightly, you can still continue doing your work very well without any problem, without noticing, until of course you go for a checkup. And that's why we often ask people to go for checkups. So kidney failure is graded therefore from the mild form to the severe form. If the kidney fails, you cannot remove your waste products. Therefore, if it's water, you start seeing yourself swelling, particularly swelling in the face, swelling in the legs, and the tummy as well. If those toxins that it removes continues accumulating at the far end of the spectrum, you can have a situation where you get even confused. You cannot eat, you keep on vomiting, you lose weight, so you are generally unwell. And of course, towards the end completely, you cannot survive without kidney function. So those are the different grades of kidney failure. But for majority of people who have kidney failure, it's a mild disease that you can only detect when you go to general medical checkup.
Dr. What exactly pushes the kidney diseases to actually go to the extent of kidney failure?
It's important that you go for general checkups. And if you have some of these risk factors that were mentioned. You are obese, you are diabetic, you have hypertension, you are predisposed to chronic inflammatory or musculoskeletal diseases, you have infection, then you keep on checking whether you have renal dysfunction. Once you have that kidney dysfunction, then you need to continue follow-up. So if you treat the primary risk factor well, then you can delay the progression of that kidney disease. Once you have kidney disease for some time, we call chronic, then it's usually not reversible. It is it's a relentless process that continues deteriorating over time. So what you do is the normal cells that are remaining, you ensure that you control the blood pressure or the blood sugar, you avoid infections, or you control your eating habits so that eventually you reduce the rate at which the kidney is deteriorating. So when you reach 40 years old under normal circumstances, your kidney starts deteriorating at a rate of 1 to 4 millimeters decrease per year. The normal number there is 100 mLs. Kidney works at 100 mLs per minute. So if you lose that function to 0, then you cannot survive. But after 40, under normal aging, you start losing at 5 mLs every 10 years. But if you do that quick enough, maybe 1 ml per year, you can see by the time you are 60 years, you'll have lost 20% of that function. And you can even be faster. So you're treating your blood pressure, you treat your hypertension, you ensure that you don't take medicines unnecessarily, some of them which are very toxic, particularly painkillers. You ensure that you keep well hydrated and eating well, and you don't become obese, and then you can avoid kidney failure.
Dr. I know that you've encouraged us to go for general checkup. Maybe you could guide us on the various signs and symptoms, or even how kidney failure manifests itself. That way you can actually know that you have a problem.
Initially, the symptoms in mild disease are absent, unless we had an acute illness that eventually transformed into a chronic state. So if you have hypertension and you have kidney failure, you may concentrate in treating the hypertension, but the early stages of kidney failure will not manifest. But later on, you may start having body swelling, general weakness, you are not able to eat, you get headaches, you feel generally unwell. Those are the symptoms that will make you feel that you have a kidney problem, and then you need to be checked. But by and large, most of the time there are no symptoms. So once you know you have one of the risk factors, is to ensure that you keep going to the clinic on frequent follow-up and do medical checkups as frequently as possible. By the time you have symptoms, probably too late in the day for any prevention. And maybe that's what we want to discuss, what we call organ replacement therapy, which we'll ask in the next few or so minutes.
Okay. Dr. Could you take us through the treatment for kidney failure and even tell us how effective it is?
Treatment of kidney failure is actually available. Just like many other illnesses, they are treatable. If you define the causes of kidney failure, if there are genetic, early detection of genetic kidney failures, and ensuring that you reduce the rate at which they progress towards end stage or towards kidney failure, as it were, can actually delay, and you may end up living a normal life of up to 70, 80, 90 years, normal lifespan. But if you leave that unneglected and then expose yourself to other risk factors, then you are likely to have a shortened lifespan. If you have high blood pressure, then you treat that high blood pressure. You treat it well and treat it using correct medication. Then you delay kidney failure. So initially, those are the things that you focus. But eventually, when the kidney failure gets advanced, so-called stage 3, 4, 5, then you get certain medication that will slow further progression and replace some of the things that the kidney produces that are not available now. Hormones that produce certain factors into the body and help you build your blood get deficient, so you may need to replace that. You reduce the amount of water you take because you're not able to handle and get all of it out. You have to adjust your diet accordingly because you may not be able to handle excessive salt, excessive sugar, too much protein, and so on and so on, so that you can delay progression. Yes.
Very informative, Dr. Maybe you could tell us, do we have any side effects to these treatment methods for kidney failure?
When you're treating kidney failure specifically, once you make the diagnosis of the kidney disease, then you have to know which treatment you can do. The primary kidney failure treatment is to inflammation, what we call glomerulonephritis. I've got specific medicines, and those, inflammation is driven by immune system inflammation, so you need to reduce that immunity. So you give some medication to do that, and these medications are quite detrimental, and they've got a lot of side effects. So those ones are usually given and supervised very, very carefully, because they reduce your immunity. The immunity is the one that is attacking your kidneys. So when you do that, of course, you reduce your immunity generally elsewhere in the body, so you can be predisposed to infections. So those medicines are detrimental. Of course, if you have diabetes, if you are treating kidney disease in diabetes, you give diabetic medication, you have to be careful. Otherwise, the sugar can also get too low, and you can get other side effects. If you have hypertension, the same way. Some people can't tolerate a certain group of blood pressure medications. So you need to adjust those medicines accordingly. So there's a lot of side effects depending on what is your primary cause of the kidney failure.
Maybe you could hold on to that thought, Daktari. We are going to take a slight commercial break, and when you come back, Daktari is going to be telling us more about kidney transplant. Make sure you continue hitting us on our social media platforms at KuTV Focus on Health on Facebook and also on YouTube, and Health Focus on Instagram. We love your comments. We love everything you're telling us about kidney and kidney failure. So continue notifying us on our social media platforms.